Let's talk about IUDs. This is one of the subjects that has the most misinformation about it. As I listen to my patients when I mention IUDs, they'll often say that they did research on the internet and talked to friends and found that they had horrible problems with them. And many women are afraid of IUDs. They were originally introduced for contraception, but they're also being used for heavy menstrual bleeding, sometimes for balancing hormones for postmenopausal women, or to decrease the growth of the lining of the uterus in women that have precancerous conditions of the endometrium, which is the lining of the uterus. There are IUDs that don't have any hormones, like the Paragard, which is very helpful for women who either can't take estrogen or progesterone, or who are very sensitive with side effects to those hormones. The Paragard can be left in place for 10 years, and it provides very good contraception. The birth control pill will have about 8 women out of 100 become pregnant in a year. The Paragard IUD will have about 7 women out of 1,000 become pregnant in a year, so it is very good birth control. The IUDs that have hormones have a progestin, and the progestin keeps the lining of the uterus thin. So most women with a progestin IUD notice much less bleeding, and sometimes they won't have periods at all anymore because the lining of the uterus is kept so thin, there's really nothing to come out. Progestin is also a smooth muscle relaxant, so most women notice less cramping as well if they have an IUD. We use them frequently for women who have very heavy menstrual bleeding, and this is very common. With an IUD, bleeding is cut 50% to 100% in most women. There are rare complications such as uterine perforation or infection, and you see these very rarely. The most common complication is as the uterus is a muscle, it will sometimes push the IUD out and it'll have to be removed. But otherwise, they're very helpful for heavy menstrual bleeding and to balance hormones in the perimenopause.